I'll be talking about living lives while reducing risks, and I thought what would be really useful is to go through a really timely example around Ramadan, which is currently running at the moment. So it's a holy month running from the 12th of April to the 12th of May. So just wanted to kind of really talk through the process really of how we got to doing what we did to support Muslim people across Wales to celebrate safely. So I'm just going to share my screen. Going to presentation mode. Just checking, can everybody see that okay?
Yes, thanks you.
Brilliant, thank you so much for that. Okay, so as I said, I'm just going to kind of do a very kind of brief talk through what we did to approach Ramadan and make sure that people could celebrate and practice Ramadan in the safest way possible. So what I'll be covering in this session is, where did we start, who was involved, what was needed, how did we deliver that, and then also kind of touching on why is it important, and then kind of how do we kind of expand on this work and the progress that we've made and the relationships that we've built. And again, linking that back to the framework, it's really making sure that we help the public differentiate between the high and low risks in celebrating Ramadan, helping develop the guidance or communicating the guidance on how to celebrate safely. And we've given a really consideration, about the cultural events, and we've worked with various partners, which I'll kind of touch upon as well, and then encouraging individuals and communities to identify harm reduction strategies as well, and how we communicate that effectively. And kind of, as has been discussed today, it's shifting that message from do not to do differently. I think at this later stage in the pandemic as well, we've got the added bonus of being able to say, well, we've done this before, we can do it again. And again, I will expand upon that shortly. So where did we start? Well, we knew Ramadan was fast approaching, and we knew that compared to the previous year, we needed to be more proactive. And we also knew that we had more resources and more time and capacity to be able to be more proactive as well. So if you think back to Ramadan this time last year, the pandemic, we were still very much in response mode and react mode. Everything was very busy, so there wasn't that capacity, and if we're honest, we weren't at that place where we were able to fully support in terms of having that cultural awareness and those relationships which we've now developed since then. So we're now in a place where we can work more collaboratively, and we very much saw our role as a supporting one, helping to reinforce some of the key messages in relation to guidance and in relation to vaccination during Ramadan. And this approach very much fitted in with our current way of working. And so the makeup of our communications team at the moment, we have a business as usual cell, and then we have a COVID-19 cell, and these two kind of very distinct teams. They do work very collaboratively as well, and there is crossover between the two. But this approach to Ramadan itself fitted with the ways that we were currently working, which was really important as well. But what was already happening, and who was already involved in this? Well, Muslim Doctors Cymru, which is a great group that we started to work with, were already producing a number of assets in various languages and formats. And this is a group of doctors from Wales who just banded together to form this group, and they realised that, their trusted voices were really important in this and getting information to the community. The British Islamic Medical Association was also working very closely with Public Health England and the Welsh Government to produce guidance that was in line with Islamic scholars and Islamic teachings. So it was making sure that there was this multifaceted and multi-pronged approach to making sure that we were providing the guidance in a way that was doable on that kind of practical level. And what was needed to be able to communicate this? Well, our partners were already doing a lot of the work. They were delivering messages from health professionals that represent the community in the languages that are spoken by that community. So again, Muslim Doctors Cymru have a number of members across Wales who speak various languages, and being able to deliver key information and messages in that language of the community, it removes that barrier and it makes it that bit more accessible. And they were putting those across various channels. They were also creating spaces designed specifically for those communities where they could answer community specific questions, and again in a language from that community. And they were also already producing guidance, and they'd created a web page with a wealth of resources and advice, all supported by Islamic scholars. And that was really important to get the buy-in from that religious community, because it's all good us as a health body saying things, but there needs to be that clear understanding and a cultural frame of reference in terms of Islam, and being able to understand the needs of that community and how that affects religious practices. And so it's important that we weren't trying to replicate it, but we were trying to enhance it with the tools that we have available as well. And that was very much the route that we ended up going down. So how did we support? And I know Lee has previously talked about some of the platforms that we've developed. But it was very much a discussion, and we met Muslim Doctors Cymru on one of our vaccine engagement boards set up by chaired by Welsh Government and my colleague Hannah Lindsay in our vaccine communications team. And in that engagement, I think we'd gone along to present on one of our WhatsApp communications channels, which was the new channel that we set up, and Muslim Doctors Cymru had come along to share some information about some of the audience insight and data they had gathered. And it was at that meeting where we made that connection, and we realised that actually we had two different parts of the puzzle that we could piece together to really make sure we could work in co-production to serve the same community, to serve our shared audience. So what did they need from us? Well, we talk a lot about equity, and I think part of equity is raising others' voices, not just relying on our own. And we were in a position to raise our partners' voices via our platforms. They had the knowledge of Ramadan, of the religious practices. They had the links with the local imams across the country. They had the languages and they had the resources there. But what they didn't have was the platforms that we have, the sheer numbers and volume that we have. They didn't have the formal communications setup. They're a team of volunteers, and they didn't have the editing software to be able to co-brand materials. So we were really able to add value, and again identifying that not everything necessarily has to come for us. Sometimes it is about raising your partner's voices and using those trusted voices in the communities to deliver that message. And I think the success we've had with some of the Ramadan communications is really a testament to that. So we were able to co-produce materials. As Leah mentioned earlier, we set up an easy share resource page. Well, actually on that page we have the recite me function, which allows you to translate the page into various languages. There are hundreds of languages on there, and I think about 44 of them can also apply screen read technology, and it will read that language on the page. And what that enabled our Muslim audiences to do was to be able to access this page, copy and translate the page into the relevant language, and then share that message with that community in their own language, which again was something they didn't have the time or resource to be able to do. We were able to use our newly established WhatsApp distribution list to get those messages directly to the community. And we were talking about stakeholder engagement earlier. The WhatsApp messaging distribution list was very much an amalgamation of a series of feedback from our stakeholders. So we'd initially started with a very clunky version of the Easy Share resource that you see here. And feedback again from the stakeholders was that actually, we don't have a formal communications setup. We don't have the materials, the assets, the capacity. So we need this in a much easier format. So then we thought, well, why don't we just send them the WhatsApp messages directly, and then they can forward it on. And that has given us a whole new, a more timely approach to being able to do this. We can be more reactive. Just this morning I got a WhatsApp from Imad from Muslim Doctors Cymru saying, oh, we've got this we've got a pop-up vaccination station in one of the mosques this weekend. Can you help communicate that? We can be very reactive and very quick in response in that respect. Similarly, using our Padlet that we set up, where our partners and our stakeholders can access information. And again, it's not just the information for organisations working with Muslim communities, so it's not just tailoring this to Muslim Doctors Cymru, to the Welsh Muslim Council. Actually, if we think about the NHS across Wales, if we think about our local authorities, our local public health teams, they can now access, and our staff as well, they can now access these resources, and they can be ambassadors for equity and kind of creating that equitable approach to guidance and COVID safety measures. So it was really important that we could deliver that. And like I said before, it's about piecing that puzzle together. We had one part of the puzzle, they had the other, and now we've been able to create a really unique and bespoke experience for our Muslim community in Wales. Again, how this links back to the framework and strategies, it's encouraging individuals and communities to identify the harm reduction measures. And it's again shifting from that do not messages to the do differently, and using trusted voices to deliver that messaging as well. And just to kind of go over why this is important, well, linking back to some of those 5 cross-cutting principles, it's about fairness. And it's about health equity. It's about making sure that a community that's already at increased risk of coronavirus and is already experiencing health inequalities is receiving kind of information in an equitable way. It's about us proactively putting ourselves out there and reaching out to that communities. We often describe Black, Asian and minority ethnic communities as hard to reach. They're not hard to reach, it's just that we need to proactively step into those spaces as opposed to expecting them to come to us. And again, this is where a lot of this work came from. It was, we were getting feedback from stakeholders that our audience don't come to your website, they're not on your social media channels. So it's about proactively placing the messages in those communities. And it's about building relationships as well. We've started a fantastic relationship with Muslim Doctors Cymru now, and now that's a relationship that we can actually develop beyond the response that, again, is going to continue to benefit that community beyond coronavirus and actually allow us to rebuild. And a phrase that typically is quite often used is building back better. We've established this relationship now, so we can take this forward. It's about, again, leading by example and making sure that we can set the standard for engagement with different communities and set the standard and encouraging other people to meet that standard as well. So making sure that we're encouraging Welsh Government, who have also adopted some of our easy share messaging, making sure that we encourage our local authority teams and our local public health teams to take some of these practices on board as well. So just to summarise, and I did say it was going to be a very quick overview. We started by thinking, what is happening, when is it happening, where and why. You then need to start thinking about who is involved and what are they already doing. And when you've thought about that, you can then start to think about what your role is as a public health institute. Is it amplifying messages? Is it replicating? Because there's good replication, there's bad replication, and you don't want to duplicate efforts that will possibly confuse the messaging even more. You then, once you start to kind of iron some of that out, you can start to think about how you collaborate together and how you can deliver this collaboratively, and then thinking about, once you've established that way of working, where you're going to take it, what other areas may benefit from it. Is it screening services for other diseases, conditions? Is it communicating other public health measures? Is it communicating your work as an organisation? Once you start to develop this relationship, you've got an opportunity to really build something unique, and again, tailoring messages to that community. So that, again, that was a very brief overview of the work that we've done around Ramadan, and I can link in our Padlet if you'd like to see some of the materials that have been produced from that as well. But yes, I'm going to stop presenting now, and if you do have any questions, I've not been able to see the chat while I've been speaking, so please do either raise a hand, shout out, or drop something in the chat.
I think Fanny's got it.
Yeah.
Okay, now I got the microphone on. I can also put the video on so you can see. Thank you. It was a very interesting example. I can hear my voice from the background. Maybe someone has their mic on. You can hear me okay?
Yeah.
Okay, great. It was really interesting to hear your presentation. I think this is very relevant to every country in Europe. So it was very nice that you were able to present that. If you have some materials, I think it would be interesting to see them. So just link them in the Padlet if you have something you'd like to share. I think it's really, especially what you said about, it really resonated with me when you said that sometimes it's okay to have the other organization or group share the message. It's not about who says it, it's about who will hear it and really understand it. So I think that's a very important message. Thanks.
Absolutely, thank you very much. And when we think about in public health, we often talk about partnerships for well-being and how we work with other groups, NGOs, local public health teams, and a range of stakeholders to design interventions and more kind of practical interventions. But actually, that's a principle that we can apply to risk communications. And throughout the pandemic, I think it's proven that that approach is really effective in reducing some of those inequalities in health information, particularly in specific communities. So Ramadan was a very timely example, but Leah touched upon some of the other examples that we've done throughout our approaches, certainly throughout the pandemic. So it's a really interesting approach to kind of, I think a lot more work and development could go on with that as well. And absolutely, as Leah said, the travellers community is another community often described as hard to reach, particularly if we talk about issues of trust in kind of more authoritative bodies or official bodies. There are barriers of trust in, and again, it's that communication that's really important in breaking down some of those barriers.